Welcome to BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb. And today we're going to be talking about memory loss, cognition issues, dementia, and Alzheimer's. We've done a couple of podcasts lately that touch on these topics, and we've gotten some interest. People want to know more. So we thought we'd spend some time talking about it. Globally or generally, that whole range of mental acuity breakdown is identified by a cluster of symptoms. So we thought we'd start by talking about what are the sort of general symptoms that would make a physician start to say, am I looking at some early dementia? Am I looking at the onset of Alzheimer's? And how do they diagnose? I mean, I know it's a segue, but Alzheimer's compared to short-term memory loss. I mean, can you talk a little bit about the symptoms and the diagnostic categories?
Well, you first have to talk about cognitive impairment.
I forgot
Cognitive impairment is when you just can't remember names, and it gets more frequent and more frequent. You can't recall names of people or names of places or names in general. You just get confused, you get lost. Somebody else has to end your sentence. That's cognitive impairment if you can't concentrate.
I've been cognitively impaired, and I thought it was called marriage.
Yeah, and see, marriage actually covers a lot of issues because couples often fill in the sentences for one another, and so that makes them not find this cognitive impairment to be a problem unless one of the partners is not there. So oftentimes in marriage we don't see it early on, but
because they mask it for each other,
right? And they're trying to make each other feel better.
Sure.
So and function. So a lot of times we see this at work. They say, I can't concentrate at work. I'm having trouble completing tasks. It sounds a lot like ADD, and sometimes it is. Sometimes it's just that they were never treated for that, and now it's worse. But most of the time, it's about not remembering short-term things, not remembering what they ate yesterday, and that's, or...
What did I do this morning? Where was I? Yeah, exactly.
Or getting lost while they're driving. Yeah. That's a cognitive impairment.
I love that because I watch these TV shows, lawyer shows, and they have somebody interrogating a witness and say, on June the 5th in 1973 at 8 a.m. in the morning, where were you? Well, and people can answer that question. I couldn't tell you where I was yesterday at 8 a.m.
Well, you were going to go to law school. That's what lawyers are for. They sit down in a room and talk to you about that. My husband's a lawyer. He does that all the time. He talks to you about recreate where you were on that day. You've got to go back and look at your calendars. You've got to go recreate it. So you don't really remember it.
Right.
You had to go create it. No one remembers that except a few people who have very unusual brains.
Right.
No one can do that.
Okay.
So that's not what we're talking about. We're talking about normal life. You've always been able to function at a high level. You have a job that requires thought and organization, and then all of a sudden you can't
so scattered,
do it.
You can't pull it together.
And that's cognitive impairment. Okay, that's not Alzheimer's, that's not dementia. When that gets so bad that you can't function, then you have to be evaluated for Alzheimer's and and dementia.
All right.
And that means you have to have an MRI of your brain to see if your brain is shrinking. Alzheimer's causes brain shrinkage.
The incredible shrinking brain.
Yeah. And it does, and that is part of an Alzheimer's workup. And then they look for plaques in your brain, because plaques mean you're developing this goo on the neurons, which is like taking an electrical wire and blocking it by putting too much insulation around it, blocking its ability to communicate to the other side. So that's part of Alzheimer's. Then they also look at other factors that I'm not a radiologist, I can't tell you that, but I read the reports. And they come back and say, yeah, this guy's got Alzheimer's, this woman has Alzheimer's, and we're going to start him on medication. So that's one thing. Now dementia can be from many things. Dementia can be vascular. You can have strokes, mini strokes all over your brain. That can shrink your brain. But usually it shows just not an overall shrinkage, but little areas that have shrunk, or little areas that have white spots on your MRI.
So like dead zones in your brain?
Dead zones.
So the synapses that fire and connect to those files can't find those files?
No, the files are gone because you've had mini strokes. And that's from high blood pressure, and it's from hypercoagulation, like too many, like you are hypercoagulable.
So a mini stroke, there's a tear in the blood vessels, and blood leaks out into the brain?
No, it's a blockage. It's like it's a blockage of a vessel usually.
Okay.
It's usually not a bleed. It could be a bleed, but it's a blockage of the vessel with plaque.
So the brain cells around it die from the lack of nutrients
Oxygen,
in blood cells.
yeah.
Okay.
And then there are some dementias that are caused by bleeds. They're less likely, and they're less likely to be silent because that hurts. You know, that increases the pressure in your brain, so it's less likely to be a silent change.
Right, because your brain is, the skull creates a limited capacity, and your brain floats in a fluid sac, and if blood starts to pour into that environment, it has no way to expand, to absorb the fluid, so it compresses and kills brain cells.
Right, it also causes pressure, so it hurts.
Yes.
So that would be something that you would probably know that you'd undergone, but a lot of these changes are very silent. Then there's the changes of Parkinson's. Parkinson's can cause dementia. Parkinson's is a lack of dopamine. Dopamine's a neurotransmitter, one of those little chemicals that runs around your brain and has lots of functions. So Parkinson's is one of the dementias.
Right.
It's more than that.
It's more than that.
But it's a loss of dopamine.
Because there are motor neuron issues with that as well.
There are. So it's not just inability to remember, inability to react normally to stimuli.
The main medicine for Parkinson's is L-Dopa.
Right,
which is
dopamine.
Dopamine, yeah.
And there are new medications that cause L-Dopa to go up, so it's more of a stimulatory kind of medication, but still they have side effects. One of the other things that happens with Parkinson's is that you lose your balance, you lose your ability to walk. You can tell by how they walk that it's a little different. Can't play sports. Anyway,
yeah, I heard this morning that George Bush the Elder has Parkinson's. So.
And that's something that I hope to never have.
Yes.
But all of these things that have to do with dementia, memory loss, except for the stroke part. Anything that has to do with stroke is out of this group, but all of those are sensitive to hormones. In women, estrogen and testosterone, and in men, testosterone. So they found many studies that support what I'm saying, believe it or not. They're in the endocrine literature and not in the neurologic literature, so oftentimes neurologists have to go outside their specialty to find them, but I've got some neurologists here that do.
Right.
And they understand this, but when brains deteriorate, they don't deteriorate if you feed them the right hormones.
Okay.
Okay? It supports them. And so if you give a woman back her estrogen during the 10 years after she goes through menopause, then she delays the onset of dementias, except for stroke dementias, by another 10 years. So she's got the 10-year window and then another 10 years until she would get it normally by her genetics and her lifestyle. If you give her testosterone when the testosterone stops, then you've delayed it another 10 years. So a woman could get 20-year extension on her onset of dementia by giving her testosterone when that stops and then estrogen when that stops. And I see this every day. People come in and on their questionnaires, they have, I can't think anymore, I can't do my job, I can't recall things, people are finishing sentences, I feel like I've lost my mind, I can't remember what I was going for at the store.
Well, it goes from being frustrating to being frightening.
It's scary.
Yeah, because it's frustrating when you can't remember, what was on the grocery list because you didn't write it down. And that's a simple everyday irritant. But then when you're at work and there's critical data that you are supposed to have access to because you know, and you can't get it, you're jeopardized.
It's terribly scary. I mean, that part of what I experienced after my ovaries were removed, that was the scariest thing.
Well, and for you as a physician who had that life and death responsibility for your patients,
right, I was doing deliveries and surgery. It was scary.
Yes.
It was very scary. And I had to use all of my energy just to perform well at work, which I did, but then I had no energy
at home
or
for a social
else.
life or relationships.
I just passed out. I mean, you have to use so many brain cells just to get through the day.
Yeah.
And that's what I see my patients struggling with. And,
they're exhausted, they're tired, they have no energy, their social relationships diminish, they get in trouble about sex because they don't have any energy left for that or desire with the testosterone loss. But all of that just starts to cascade into a zone of frustration and anxiety.
And they're afraid to tell their doctors about it.
Yeah.
Because they're afraid their doctors are going to, oh, you have Alzheimer's.
We need to put you in a home.
Right. We need, yeah, you need to be hospitalized forever. But once I've asked them about it in relationship to testosterone, then they fess up and say, yeah, I've had that, and it scares me to death. I'm afraid to talk about it.
Yeah.
So interestingly enough and gratifyingly enough, I love giving testosterone and 3 weeks later having somebody call me and go, I can remember everything, my brain's back. And
I just called you because I remembered
yeah,
your phone number.
That's right. It's true. Yeah.
Yeah, exactly.
And they can, you know, generally, and I'm talking 90 to 95% of my patients who have this issue actually get their brain, they say, I have my brain back.
And so not only that, but then all the energy that was being consumed trying to track the mental processes now becomes available for the living of life.
And they're productive at work. They don't lose their jobs.
And because
I mean,
you
so
replace
many
their
of them,
testosterone, they have a libido, and now they have the energy to act on the libido.
Right.
So,
as usual, Brett's talking about sex again.
Harmony
We were talking about the brain,
on the
but
home
of course,
front.
we're done. So
it's important.
I know, and
you know, I mean, you laugh and you make jokes about it.
I know,
you
but
know
I
how
think
important
it's very.
it is.
I'm not diminishing that.
All right.
I think it's very important. I'm just.
The question is, are you increasing it? And the answer is yes.
That's right. We are, and that also benefits neurotransmitters as well, because all of the neurotransmitters are activated when you have sex. So, having said that,
there's a card store in St. Louis, or it used to be a card store in St. Louis called Huffalumps, and you could get all these really outrageous cards there. And I remember seeing one time. It was like the cartoon figures of the 1940s woman, you know, in household, and she's slapping her forehead, and she looks at her husband and says, "Oh my God, we forgot to have children."
Oh.
So that's what I think of when you talk about the recovery of the mental acuity, the alertness, the energy, and the libido that is possible to have for people that have lost it. The loss of it is so incremental and slow that you may not know until it's fairly advanced. Partly because, again, well, you're in denial, but also, as you were saying earlier in this podcast, your partners help compensate for that because they're so used to you and the way that you think and the things that you talk about or do or want, that you can say, "Oh, honey," and they say, "Yeah, here's a soda," you know, and so you don't have to complete that thought.
You've told us before, but they say that when you have a couple that's been married for a very long time, that you have divided up your information.
Yeah.
One person in the couple remembers these things, and the other person remembers these things, and nobody actually remembers everything. So if someone passes away or someone is divorced, they have half a brain.
People at church or people will call and ask me something, and I will say to them, "I'm not required to track that information. You need to speak to my wife." And then I get this long silence, like, "Is he kidding me?"
Yeah. Okay. Well, and that's how most of us act. I'm like, that's not my job.
Yeah.
He does insurance or whatever.
Right. Yeah.
I'm not doing that. So and that's okay. It's just that's not dementia. That's just couples.
No, that's a division of labor.
It's division of labor. But when that person in the couple forgets everything, then the other partner notices it more than the person in the couple, because she's still got your half a brain.
Right.
Yeah. So
as long as my half is working. But if I have dementia and I forget to tell her that I spent the house payment at the gambling boat, then she's going to be really disturbed when they foreclose.
Absolutely. And I can't even imagine that. I mean, that's something I don't want to go there on this podcast.
I forgot to pay the bills.
Yeah, that would be awful. But I haven't had to deal with that.
Yeah.
Interesting is that when I was trained in hormone replacement, I've learned so much in 10 years. When I was trained, I was not trained that it had anything to do with our memory. But it had something to do with my memory, because my memory came back right away. I was like 2 days out from pellets and testosterone and estrogen, and I was completely back in my brain. My body took a long time, but my brain came back. I was shocked, and then I thought, well, maybe that's just me. And then I started asking on my questionnaire about it, and so many people wrote that down, and so many people got better, that I then did the research on it.
Yeah.
And said, what is this?
Well,
and I found the research, but it's not in the neurologic literature. Neurologists who take care of Alzheimer's, who take care of dementia, who take care of stroke
And it's not the gynecological
patients.
literature.
No, it's not. It's in endocrinology. Endocrinologists don't deal with dementia.
I have to tell you.
It's just killing me. I love the research they do, but why is it not sent somewhere?
Why is it more easily accessible and more pervasive in the literature?
Well, their fellows are doing research on brains, but it's not getting to the neuro literature. Why is that? I don't know, and I don't get it. So,
well, I have to tell you, when we started doing these podcasts over a year ago, I sort of had the impression that you were a one-trick pony. The only thing you could ever say is testosterone, testosterone, testosterone. As
really?
I have, well, let me tell you, as I have learned through the association with you on doing these things and the things that we read, the articles we read, the research we look at, the studies we look at, it truly is a miracle rejuvenation process to get your testosterone back if you've lost it, because it leads to the reduction of all of these other symptoms and all of these other medicines and all of these other problems that if you didn't replace your testosterone, you would have. And
so you're calling me I am a one-trick pony then?
But
I have to know about all these other things. But I have to know about all these other illnesses.
You do.
I have to have investigated them. A lifetime of primary care helps.
Yeah.
A lifetime of primary care really does give you the
25 years
background
in the trenches
for knowing how things are managed by specialists, how things are managed by internists, how we all take care of patients, how we should take care of patients, and the outcome. So I've had that in the background. I did a lot of primary care anyway because patients didn't have time to go to their internist or their family doctor. They were in my office for pelvic, and so I tried to solve their problems, sleep apnea, things like that. So in general, back to memory, dementia, and Alzheimer's.
Right.
There are studies that say that women's brains shrink if they do not take estrogen.
Right.
During the 10. Now stop. I'm going to make you be the other half of my brain for a while. Anyway, if they don't take estrogen for the 10 years after menopause, that their brains shrink. That was done in 2002. It was a headline and everybody laughed at it.
I was just laughing because I remember as a child, my grandmother used to say there's something rattling around in my head. It was her brain. Because she
didn't take estrogen.
Well, nobody did back then.
I know.
And so when you said that, I had a flash of my poor old grandmother walking around the house and there's something rattling around in my head. And it was her shrunken brain.
And so we're trying to wipe out shrunken brain syndrome. Yeah. Because if you take estrogen, it has to be, you have to take estrogen at a high enough dose that actually helps your brain. And the trend today, trends are always interesting. They always go down all the way to one extreme and then they come back to another extreme, and someday they'll hit the middle. But the trend today is to give as little as possible.
Right. It's all a minimalist approach. We don't want to intervene.
Do we do that with diabetes? I'm going to give you the littlest amount
of insulin
possible. Yeah. I'm going to let your glucose go way up. Right.
Yeah.
I'm going to give you the smallest amount of cholesterol medicine so that you're just like halfway between where you are now and good. No, we don't do that with anything but hormones and women's hormones.
Yeah.
We don't do that with testosterone either. More is better for men, but not for women, obviously. But we're going to swing back.
So I don't know whether that's
help us
medicine or the general population, because there is a movement. I run into a totally different area when I work in counseling with people that have children that have ADD. And the question is, should we give them medicine to help compensate for those issues? And there's a cultural concern out there about medicating my child. The school teachers just don't want to deal with him, so they just want to medicate. And they have no understanding of what the medicine is or how it works or what it does. But there's a cultural resistance.
Right.
Do you find the same thing with estrogen replacement, or is it a medical, pharmacological, insurance concern?
It's not insurance. It has to do with the WHI study, which was wrong.
Right.
And all of medicine embraced it without reading it, then read it.
Because they read the headlines.
They read the headline just like everyone else, took everybody off estrogen, then they never read the retraction, and so they still have people off estrogen, or I'm just going to give you a little tiny bit of estrogen, which doesn't do anything. I do their lab tests. It doesn't even look like they're on anything when they're taking low-dose estrogen. Doesn't help them.
Right.
So what's the good in giving you a pharmaceutical product that
so if you're not getting a clinically effective dose, it's a waste.
Right. It happens with thyroid too. And so since we're on the minimalist stuff, I had a patient recently who had a doctor give her 25 micrograms of thyroid. Okay, she's young and healthy. The only risk to thyroid is a high heart rate, which she had a very low heart rate, and she's young. There's no risk to giving her a normal dose of thyroid, but he said, oh, let's just give her a little bit of thyroid. So she actually went through becoming so swollen. It's called mixed edema when you have no thyroid. She got so swollen, it got worse after she took thyroid. Thyroid usually gets rid of fluid in your tissues and makes you less swollen. That she actually had to have fasciotomies in her legs. That means they cut down the fascia of your legs to release the pressure so that your muscles in your feet don't die from compression. You get so much fluid inside of you. So she had those things done.
So you swell up like a watermelon.
Yeah.
And the way they treat it is to cut the skin.
And the muscles, they cut the fascia, the connective tissue around the muscles.
Oh my gosh.
Usually it's used for sports injuries, like you get a blow and blood fills in, and then your muscle starts dying and your foot starts dying. So then they cut a line through there with a scalpel. It's a very emergent thing, and they did that to her to save her feet and her legs, but truly what they had done was they gave her a tiny bit of thyroid. It was enough to shut her own thyroid down.
Right.
Just enough to shut down her thyroid, not enough to replace her.
Right.
They made her worse.
Right.
She swelled up more. And so I had to go through this thought process of here's how this fed back to your brain, shut your own stimulation down, but you didn't have any thyroid.
Yeah.
And so you swelled up. So in any case, that's the problem with giving, oh, we're just going to give you a little bit. That doesn't really work with hormones of any kind.
Right.
You have to either replace it or not replace it because it shuts down your own production.
And do you know that you have a clinically effective dose because you can measure that with blood test, or is it an anecdotal reportage?
It's both.
Okay.
I mean, if I have a lab test that tells me that a patient has too much or too little thyroid, but all their symptoms are gone. Their hair's growing, their nails are growing, they're not swollen, their energy's back.
So we come back to
they're not constipated.
You have to spend the time with the patient. The
to
patient
ask
needs
them
to have
the
time with the
questions.
doctor and have a good clinical interview.
Right. And unfortunately, that's what the insurance companies are limiting.
Mass consumption, Walmart medicine.
Right.
Yeah.
One thing at a time, not looking at everything. But the problem still lies in, even after you do that, some doctors still look at the lab test instead.
Yeah.
And so lab tests are important, but frankly, for things like this, you need to get enough estrogen that your brain doesn't shrink. You need enough testosterone that you get back to normal, healthy levels. Estrogen should be back to 60 to 250. That's where we are when we're young. That's where you should be.
Well,
testosterone should be over 30. So,
as you can tell, we're both very passionate about these topics, and we are intrigued with presenting you with the information that you need so that you can become an intelligent and educated consumer of your own medical processes. So if you have questions about what we are talking about, or if you have comments that you'd like to share with us, feedback that you'd like to give us, you can reach us directly.
At podcast@biobalancehealth.com, or you can go to my website, biobalancehealth.com, or you can call my office, 314-993-0963.
And you can always reach me directly at brettnewcomb.com.